These are 6 things that you can do after having liposuction. Not really that you can do. 6 things that you should do to get the very best result after having liposuction. Your surgeon is really responsible for getting you the very best shape. That comes from the liposuction. After that's done in the operating room and you leave the operating room, you're going to be in your faja. You're going to continue to wear the faja for 3 months. 6 weeks, you're going to wear it 24/7. The other 6 weeks, you're only going to wear it during the day, 12 hours a day. When you get home, you go to bed, you just remove the faja. You just sleep without a faja. Now, that's number 1. Everybody knows about the faja. It's critical, super important. Faja number 1. And listen, don't worry if you're not writing these down or you don't know where they are or you're not following, because this is all part of my Ogee recovery protocol for recovering from liposuction or BBL. Don't worry, this is available at ogeerecovery.com and you can just print this out yourself. Moving on, number 2, boards and foams. That's number 2 and 3. So you're going to wear boards after having liposuction. This is an example of a board, and it is a board. It's solid. There's a plastic in here. This is going to fit in the front of your abdomen. This is going to compress the front of your abdomen after having lipo. You're going to do something exactly the same in the back. It has a different shape to it because it's going to fit in the small of your back. This also has a board inside. These are firm. These are designed and meant for compression. You're going to compress in the front and you're going to compress in your back. But here's the very important point to know is you're only going to do that for 2 weeks. And I'm going to talk about that in a minute. Also, very valuable is foam after liposuction. These go on the sides or the upper abdomen or the upper back. They fit right on your skin, just like the boards go right on your skin, and they go underneath the faja. I often think that people that when they come back and they're wearing their faja and wearing their boards and foams, it's like they've got like some type of armor on. They're sort of in this stiff position. That's what we want for the first 2 weeks because we're trying to compress, we're trying to prevent a seroma. Seroma is the fluid that develops underneath your skin, and we don't want that. We want you to have compression. We only want you, though, to do those steps with the foams and the boards for 2 weeks. What happens at 2 weeks? That's when you're going to switch, get rid of the boards and the foams. You're going to switch to FibroGuard. What is FibroGuard? This is FibroGuard. This is a brand new product that I developed and manufactured with the people that made my faja, the Ogee faja in Colombia. They're wonderful and they do such good quality work. What we did is we came up with this new product called FibroGuard. Called FibroGuard because it guards against the development of fibrosis. Fibrosis is where you get scarring in your skin and the deeper layers in the fascia, and that scarring can produce lumpy, bumpy skin, otherwise known as fibrosis. That can ruin your result. It's permanent. There's no treatment for it. So the only thing we can do is to prevent it. That's why I don't want you wearing the boards and the foams for longer than 2 weeks, because this will stick your fascia down, give you fascial scarring, and give you lumpy skin. So at 2 weeks, we get rid of the foams and the boards. We move to the FibroGuard. FibroGuard has built-in little tiny foam half spheres, and just with breathing, walking, moving around, these little FibroGuards that are directly on your skin, they're going to create little micro movements that open up the lymphatic channels and get rid of the fluid and keep your fascia soft. Remember, soft fascia, soft skin. This is of paramount importance. It is very critical in getting a soft fascia, therefore soft skin, therefore a good result, to roll. There's other videos that I've made about rolling to go through the rolling protocol. You use it in 3 different ways. Not going to go into detail here, but suffice it to say, step 1, you use this immediately after surgery. You can even use it in the recovery room on top of your faja, and you just rolled very gently to help with the nerves. You switch at 2 weeks when you get rid of the foams, you get rid of the boards, you put your FibroGuard on, you put your faja on top of that. Then you start to use the roller in a different way. That's when you're going to use the roller in a different way. That's when you're going to take advantage of the power that the roller has with its high vibration. So this will vibrate, and we keep it on high vibration, and we do that and roll in only one direction. And the sixth thing, which is as important as all of these steps, is you're going to do your massages. The massages that I advise you to do is to get 10 massages. These are traditional massages over the first 2 weeks. So for the first week, you basically get a massage every day. For the second week, you'll get a massage every other day. That's the 2 weeks after surgery now. You've done your 10 traditional massages. Then I recommend getting 5 lymphatic massages over the next 2 weeks. Those are a completely different type of massage. That's not a traditional hard massage. That's a very different technique performed by people who are trained in manual lymphatic drainage. It's a very light massage where you're just opening up the lymphatic channels and you're helping to direct the fluid into those channels. And once it gets in the lymphatic system, it goes back to your heart, goes to your kidneys, and you get rid of it. So those are the 6 things that you need to be doing. You need to be doing them in the correct order. You need to be doing them for the correct amount of time. I've documented all of this in a very easy to follow Ogee recovery protocol, and I've designed this and design some of these products here specifically so that you get the best results after having liposuction.